is being made for food relief to the most needy in the Kingdom of Eswatini. I should start by saying Mr. Kirsch sends his greetings to everybody and his family, to everybody in the kingdom. He is locked down at the moment in his apartment in Cape Town with his wife, with one of his children, and the rest of his family is scattered all over the world, a lot of them in America and elsewhere. But he really wanted me to send his greetings, to say that he has been with you in his heart, and that he has been watching with great concern as the crisis has unfolded in the kingdom. And as a concerned Liswati, he is very anxious to do what he can to help. And right at the beginning of the crisis, he asked me, what is the best way to help? And I liaised with the government, and they told me that PPE was the most important thing at the beginning, followed by food, followed by transportation, and then other essential medical equipment like rapid result test kits. And so Mr. Kirsch said, okay, let's give some money towards this, and we have been doing so over the last 8 weeks. He immediately donated $350,000 at the end of March, right at the beginning of the crisis. He didn't want to have any publicity, so he kept this under the radar. We worked through government, we worked through Business Eswatini, and then he followed that up in the second week of April with a donation of $5 million. So together he has donated a combination of, the money, a total donation of 110 million emalangeni. What we started with, we concentrated on was, because every other country in the world is doing the same as us, facing the same challenges, especially on the supply of PPE. And we all know, and Mr. Kirsch knows very well, that the most important thing is to keep the health service, the health professionals safe, as safe can be. So PPE was the #1 priority. And we've got this from the government. We follow that up. And so we set our Kirsch supply chains into order to try and get as much PPE in as possible. So I'm pleased to say that we have spent a total of 19 million emalangeni so far on PPE. And this is for a number of essential items that have been given to us as the need by government, such as masks for the health service, cotton masks, 200,000 for the population, N95 masks, examination gloves, thermometers, coveralls, hazmat suits, and goggles. So a large quantity of PPE has already flowed out to the health service, and they are making use of this. Hopefully we are helping our health service professionals to keep safe. The other question was then about transportation, getting this PPE and other essential equipment into Eswatini. You're probably all aware the other 200-odd countries in the world are all facing the same problem. They're all trying to source from the same supply source, and they're all trying to get it exclusively to their countries. So we are fighting against everybody else to try and get the same equipment. And in this, we've been very lucky, first of all, with our own supply routes through the Kirsch organization, but much more importantly, we're making use of suppliers within Eswatini who have been working with us, one in particular, and they have been working at cost, not any cost to us or to the government, bringing in huge amounts of PPE and other essential equipment. So it's with great gratitude that we thank that person and that company. We also managed to pay for a flight from Taipei, which I think all of you have seen in the media, which brought in the essential ICU doctors from Taipei. And of course, we are very grateful as well to be partnering with the government of Taiwan, who have stumped up at this time of crisis for Eswatini, and these essential doctors are on the ground and doing their job. We are now looking at sourcing ventilators from various countries, because this is the next big crucial thing as we are reaching our peak in the next couple of months or so, as we're told by the experts. ventilators will become more and more important. So we are using our supply chains to try and source ventilators. I'm pleased to say we have got a source, and in conjunction with others, again, I think the Taiwanese are also producing and sending over ventilators. It's a joint effort, and Kirsch Foundation is delighted to be part of that effort. Today is all about food. We recognize the extraordinary burden being put on the country, on the kingdom, and on the people. As the lockdown, the absolutely necessary lockdown, was put in place, so food became an issue. And so Mr. Kirsch is keen to help with that. And as I say, he's donated 45 million emalangeni. And I want to, at this point, commend government very strongly, in particular also the NDMA Director, Russell Lamini, and his staff. This is an extraordinarily complicated challenge to understand precisely who are the most needy in the country and to get that food aid in terms of cash out to them. And we've been delighted and very impressed with the way the government has stepped up to this. It's not a question of just saying, oh, these are the most 65,000 most affected households. It required a very professional and clinical examination about who really does deserve this. So they've been working extremely hard, I know this, and they've now come to a conclusion in the next 3 weeks where I understand the money from the Kirsch donation will now start flowing out through the cell phones out into the kingdom. I think I really want to finish. I'll take questions at the end, but the final word really needs to be with Nati and Nati Kirsch and his family. Whenever he's asked about donation, about philanthropy, he says one thing. He says, don't thank me. It is a privilege to be able to be in a position to give. And he thankfully is in that position. He's in that position to be able to help the kingdom at this moment of crisis. And the door is open for more donations from Nati. And really I call on, and first of all, to commend all those in the kingdom who've already donated themselves to whatever level they can afford, the organizations, the companies, the businesses through Business Eswatini and on their own, and the individuals. We know a lot of people have stepped up to the plate. But Nati is asking all who have the ability, whether it's 10 emalangeni, whether it's 1,000 emalangeni, whoever has the ability to step up, donate through the NDMA, get the government to have the funds available to help the country. So with that, I would like to thank you all once again, Prime Minister and everybody, and we wish the kingdom well. We wish you all good health, and Mr. Kirsch stands strong behind the effort. Thank you very much.
Deputy Prime Minister, Minister Agriculture, George Lees, representative of the Nati Kirsch Foundation, NDMA representatives, members of the media, ladies and gentlemen, a very good morning. It is an honor for me, on behalf of His Majesty King Mswati III and Her Majesty the Queen Mother and the entire Eswatini nation, to receive this generous assistance from the Nati Kirsch Foundation to help the kingdom in the COVID-19 response. The assistance amounting to 110 million emalangeni has come in a form of cash, medical supplies, and the hiring of a chartered plane that brought doctors and medical assistance from the Republic of China, Taiwan, to Eswatini. A total of 45 million from this significant support we are receiving today from the Neti Cash Foundation will be dispersed as food assistance through cash transfers to the needy that have been disproportionately affected by the emergence of COVID-19. This donation will help 301,000 people across all 4 regions of the kingdom to procure food items of their choice that will preferably last them for a minimum of 1 month. The disbursements will be done over a period of 2.5 weeks beginning today. A total of 69,000 people from 11,000 households in the Shiselweni and Manzini regions will receive money to buy food this week. The rest of the regions will be covered in the coming weeks. I urge all beneficiaries of this cash transfer to use these funds carefully and for the purposes they have been given to buy food. May I take this opportunity to thank the Neti Cash Foundation for standing with Eswatini through this trying period and extending a helping hand to assist the country effectively respond to this pandemic. The Neti Cash Foundation has always been a credible and reliable partner in lifting the lives of Eswatini over the years, and for that we are grateful. Government is continuing with the implementation of a hybrid model for food distribution, which will also see food parcels being distributed to the needy. We are cognizant of the reality that many people who were not chronically food insecure before the COVID-19 are now in need of food assistance. These include workers who have been laid off, street vendors, hawkers, and others. We will continue to explore all available avenues to increase the number of people receiving food assistance. Our country is faced with a highly unpredictable scourge which has adversely impacted our health system and the economy. This phenomenon is not synonymous to this country or region, but the effects of COVID-19 are felt by all health systems and economies across the world. Government has put in place all the necessary interventions to contain the spread of the virus and to slowly and carefully ease back to normalcy in order to get our economy back on track whilst protecting the lives of our people. This is not a one-sided war, but one that needs a multidimensional approach. We appreciate the help of our partners and friends who have come on board as we intensify and diversify our interventions to contain this virus. It is more important than ever that all citizens remain vigilant and cautious in following all the health and safety precautions. We should never take for granted or get tired of washing our hands regularly with running water and soap, observing social distancing, wearing masks in public places, and at home when we have flu symptoms, and looking after the elderly. It is when we collectively and consistently become responsible for our lives and those of others that we will be able to put this notorious virus behind us. Once again, may I, on behalf of His Majesty's government, pass our sincere gratitude to the Neti Cash Foundation for this generous assistance, which is very much needed to save lives in the kingdom. Thank you. Asinivusele bekunene egameni lembube emhlaba nendlovukazi nahulumende sithanza kwemukela nasi sipho lesithola enhlanganweni ye-Neti Cash Foundation kubambisa live leMaswati kulomkhuhlane lesibhekene nawo bekunene. Namuhla ke semukela sipho lesi seyingcenye ya 110 million emalangeni lose ube wethulwa esiveni. Lesipho ke sa 45 million emalangeni lesitawusita eMaswati kuthi athole imali yekudla bekunene. Njengoba sibikile emavikini lengcile ukuthi uhulumende sosukumise uhlelo lokuthi sesitawusita eMaswati latsite kakhulu lawo laswele kakhulu kudla ukuthi sibaside. Namuhla ke siyaqala bekunene lo sethula nje siphindze futhi semukela lolusito kulaba baka-Neti Cash Foundation. Sitabe siqala ukuthi sithumelele sinike abantu imali yekudla bekunene. Lapha ke sikhuluma ngebantu labenga ku 300,000, about 301,000 webantu labatawusitakala imindeni lengu 11,000 letawufaka bantu labangu 69,000 labaphuma etifundzeni letimbili. Sifundza sekuqala ishiselo bese kuba isifundza sakamanzini. Batawuqala nje kusukela namhla bemukele le mali yekuthi bathenge kudla bekunene. Sithi ke kule mali labatayithola ayivele bekunene isetshenziselwe kuko kudla. Sigcizelela ke ukuthi kuthenge kudla lokulungele bekunene lokumaseko lamathathu kuze ukuthi eMaswati atawu timphilo tawo titogcina. Siphindze ke sithathe lelithuba bekunene sibonge yona inhlangano ye-Neti Cash kubambisa sive seMaswati kulesikhathi lesilikhuni kangaka lesibhekene naso bekunene. Nati Cash ke sive siyamati ukuthi uliswati le selahlala kulamanye emave kodwa alikabulahli ubuswati balo. Lithi tena liva ukuthi live la kangwane selibhekene nalesimo lesi lase liyathinzeka bekunene. Kungako namuhla silapha sitowemukela lolusito lolukhulu kangaka lesikholwa ukuthi utawusita eMaswati lamaningi. Hulumende ke wethulile nasesiveni ukuthi lo lusito lokudla lelisitawu besinike eMaswati lona kusukela namuhla lutabadi igaba letimbili. Sitawu thumela imali eMaswatini ukuthi akhone kuthenga kudla. Siphindze futhi sinike eMaswati kudla lesikubita ngokuthi kudla lokwehlukene ama-food parcels bekunene. Lesethemba ukuthi atawusita ikakhulu kulabo labahluphekile nalaba ke lesesibonile ukuthi bebasebenta kodwa ke ngenxa yekuthi sekumiswe tinto letiningi abasakhona ukuqhubeka nemabhizinisi abo. Labanye bebasebenta, labanye basebenta etinkampanini, labanye basebenta batisebenta bona nje bekunene. Bonke laba batawubukwa kulolusito lesithi siyalwethula esiveni ukuthi basitakala kanjani. Noma ke bekunene singasho ukuthi emandla uhulumende atawuhamba afike la khona likhono lifika khona ngoba singete sakhona kusita wonke umuntu ngesizathu sekuthi nathi tindleko akusito letanele kodwa sitawuzama konke lokusemandleni ukuthi labo lesingabasita sibasite bekunene. Sibonga nje ukuthi nayo inhlangano yaka NDMA le phasi kwelitiko la Deputy Prime Minister lisebentile netinhlangano letahlukene kuthi kubonakale kutholakale laba labangasitakala bekunene kulolusito lolu lesilethulako esiveni. Siphindze ke sibonge nakuto tonke letinye tinhlangano neMaswati nje lasafake litshe sivivanene ekuthenini sive seMaswati siphile. Siyabona nje kunalaba bethola kudla tindzaweni letahlukene telive bosomabhizinisi netinhlangano letahlukene. Sithi siyabonga kakhulu bekunene, asichubeke sikwende lokhu ngoba yinto lenhle ukuthi kulesikhathi lesi sikhona kusita bomnakethu nabodzadzewethu labasesimeni lesibucayi labeswele kudla bekunene, ngoba lo mkhuhlane sowulethe letinye tinkinga eveni. Lenye yaleto tinkinga leto ngilena yendlala, ukuthi bantu abasakhoni kuthola kudla. Siphindze-ke bekunene sigcizelele ukuthi eMaswati akalandzele yonke lemigomo uhulumende layibekile ekuthenini sivikele kuthola lesifo kalula. Sithi-ke eMaswati akangaphelelwa ngemandla, akachubeke ageze itandla ngemanti lahambako nangensipho, aphindze futhi angasonzelani, angaqhawulani, bekunene agqoke ama-masks ngaso sonke isikhathi, ikakhulu uma ngabe aphumela ngaphandle atawuba kubantu. Na utiva ukuthi uphathekile ungathi unemkhuhlane, phuthuma uye esibhedlela noma eklinikhi kuze ukuthi utothola lusido. Siphindze-ke bekunene sigcizelela ukuthi labo labadzala emakhaya sibavikele, singabi lula ukuthi labantu lasebakhulile nalabo-ke labagulako baluthole lo mkhuhlane lona. Bekunene sithi-ke sigcizelela lokho ukuthi asivele sichubeke sihlale emakhaya, nangabe kude sidingo sekuthi uhambe uhlale ekhaya ungaphumi. Bekunene sithi-ke egameni lahulumende wembube yemhlaba sibonga lolusito lesilwemukelako namuhla lwa 45 million emalangeni kuyo iNathi Cash Foundation. Sithi kungathi inkosi ingabusisa nalapho bathethe khona bekunene kusita sive seMaswati. Siyabonga.
COVID-19 is an infectious disease caused by a new coronavirus introduced